Hello, Namaste. I welcome you all to the 70th session of Guru Bodha. And this class is made live for easy Ayurveda weekly classes subscribers. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. So, kicking off this session is a rare disorder which Dr. Gururaja sir has successfully treated is lip liquor dermatitis case study. And this is treated in Development Ayurveda Center. And this is the before treatment and after treatment pictures.
This case has visited my clinic, I think roughly 50 days earlier, and he came all the way from North Karnataka part, and he has visited with this, and is a totally a young kid without any much abusing things. The only thing is the exact reason for it, why he developed this type of something like a disfiguring thing in the face. So when I examined that, it was not a tinea as such, because it typically looks like a tinea infection, but it is not a tinea. So then I examined and I asked about the habits of the child, whether he's going on licking the lips and all those things. Then he was not aware whether he was doing that one or not, and he was totally unaware of the practices. What maybe his mother says, maybe he doing that one, so, licking the lips. So that might have led to this. Then it is decided that it is a lip liquor dermatitis, a very typical condition. Usually those who are having some stressed lifestyle or some child with some compromised conditions, maybe at the level of family matters or maybe in study or peer pressure, whatever it is. So they develop these things. And typically there is no itching, no oozing, nothing, only burning sensation, cracks, and this disfigurement. So then based on that, considering this as a Rakta Pradosh Vikara, I have started treating with Raktamrita Kvata and a combination of Gandhaka Rasayana and Arogya Vardhini with in the form of a capsule called Pentasor, and that I have used him. And within a 1 month, has become a very clear, almost 70%, 80% it is cleared, and is expected to come back once again after 10 days now, after completion of second month of treatment, and probably it will be totally clear by the 2 months time. And local application, I have given him some moisturizer, which is not very typically any Ayurvedic thing, simple moisturizers. I have used it. That Pentasor actually, it will be available to the market. It is not yet released to the market. This will be available in the name of Sorapent. Capsule Sorapent. It will be available in the market. It contains all Manjista, Neem and this Panchatikta and everything. Along with that, it also contains Arogya Vardhini and even Gandhaka Rasayana and a little bit of
Can you please enlist a few ingredients of this Raktamrita Kvata, sir?
Once again, Raktamrita Kvata, it also contains Manjista, Nimba, all Pikta Dravyas, Kiratikta. These type of drugs are present in that.
And usually when it is just, there is no itching and there is no oozing, and clearly, the lip licking is causing this.
Probably that licking is the one which, because the saliva contains a very strong, sometimes acidic material. If you go on licking the lips, it becomes, rather than soothing effect, the lip starts breaking up. It's a very common thing which happens.
And so we are not per se treating any skin infection here, rather than the effect of, say, acidic saliva in and around, and the disfigurement is what we are treating. Correct, sir?
Yes, it is considering this anything which is presented in the form of Vektasthana is in skin. We treat this as based on Rakta Pradoshya Vikara.
Yes, sir. And you said that the client had burning sensation, cracking and disfigurement.
Yes.
And bitter herbs such as Manjista, Neem, Panchatikta, etc. Pittahara. So is it safe to assume that Pittahara line of treatment was adopted, sir?
It is a Rakta Shodhaka Pittahara type of treatment.
And especially the facial skin, this kind of disfigurement or changes in the pigmentation is quite common, and often it overlaps the actual disease. Disease gets treated, whichever maybe it can be even acne, but the brown spot sometimes stays for a longer period of time. Any specific
medication will even remove that spots also.
And I mean, it may not be in this case, say, acne is gone, but it has left a mark, for example. Then which angle should we use?
In those cases, the best three drugs would be Kumari, Manjista, and Jyotishmati.
A very interesting case. I do not see any specific questions on that. Thank you very much for presenting this case. And probably we will also have an update on this case further.
Yeah, beautiful case presented by Gururaja sir. Thank you, sir. Good choice of medications, good interpretation, and very rarely we get to see and diagnose such cases. As sir was explaining this particular condition, I was going through this condition, lickers dermatitis or cheilitis as it is called. So two more points have been mentioned here, like cognitive impairment in adults and children is one of the main causes. Apart from anxiety, nervousness, and even boredom, anxiety and nervousness, we can see vata relation here. We can also see cognitive impairment has been stressed upon as an important causative or a trigger factor in adults and children both. So cognitive impairment may be there. Interestingly, one more point, impulsive behavior. So that is one thing, impulsive behavior. Like
but in this case, there is no impulsive behavior, anything, and even cognitive functions are very, very good. He is a very bright kid in the class and very active, and that's the reason because of these disfigurement he is feeling somewhat odd in the class. So that was the reason to visit me, and he is a bright kid with good cognitive functions and all those things, and there is no impulsive or any behaviors. I just gone through all these things. One thing was he was unaware whether he is licking or not, but mother says there are chances he licks the lips. So that may be the reason for that.
Your presentation was perfect, sir. So like you also gave the causes. I was just adding up the points like in different varieties of this case, what may be the causative factors, not in this particular case which you have presented. Like if we consider that nervousness, anxiety, compulsive disorders, and also cognitive impairments, or the causative or the trigger factors of such conditions, we can think about addressing this issue with like Medhya and other conditions, other medications which have been mentioned in Unmada and Apasmara condition. So I felt so, and also some Vatahara treatments, even maybe a Gruta or Yamaka application, just like we do in Vaipadika and other conditions. Your thoughts on this, sir? So I just thought of including these points in case this case presents from different etiological factors.
Different etiological factors definitely yields to this type of condition. But the thing is, ultimately, licking the lip is the reason for this condition to manifest. So whatever the drug we are, because of the trying to identify the nidana, then we can try to avoid the nidana. But only thing is that the nidanas are triggering him to lick the lip. So that only that licking the lip has to be avoided. For that, we need to take care of the things.
Nidana Parivartan. Thank you, sir.
And there is question that did the child had good mouth hygiene or pitta prakriti and hence saliva is acidic, please?
Good hygiene, mouth hygiene, there is no such issues. Is clean, neat. But only thing is, yes, he is a pitta dominant personality, and saliva is somewhat, many times the saliva is very thick also in many times. Even that's why you can observe that dogs also many times they try to lick the wound with the thing, that because the saliva contains too many chemicals in that. Similarly, in human body also, that saliva has a lot of pH values ranging from that nature, and usually it is little bit acidic in nature, and that's why if it is continuously being licked, then there is a chances of breaking or yielding of cracks in the lips and all those things, and saliving area becomes inflamed, resulting in that condition.
Thank you, sir. And moving on, there is a question of a child not necessarily related to this condition. Some guidance for a child who had burns for 50% of the body, was in hospital for 60 days with multiple surgeries and is now discharged, has severe itching and some flexibility issues. This is a case of like burn injuries and is now discharged, and because there is flexibility issues also, maybe a standard Pitahara line of treatment would be appropriate here, sir. Gururaja, sir, please.
Very clearly, the patient has burns up to 50% of the body, now recovered after multiple surgeries. We don't know the exact areas involved. And usually if limbs are burnt and if this type of things are there, then there is chances of strictures formations, and there will be flexibility issues and itching, maybe because of some glands they are producing the sweat and trying to keep the moisture of the skin might have been lost. That's why there is a dryness and itching and so many things. So in these cases, what we can do is simply we can go for, if the patient could be able to tolerate the thing, then we can go for Murivenna Tailadhara or even Mahanarayana Tailadhara. And application some gels containing Kumari, aloe vera.
Shatagauta Gruta can also be considered.
No, for purpose of doing some dhara, you require something which is to be in liquid form. Dauta Grutan, when we need to go for more number of quantities required, and it need to be made into diluted, and then you know to go for the dhara, or simply smearing the place and doing some sort of supporting bandages, then Chatadota Gruta can be used.
So just in the case of burns injury, more than 50% burn, what we actually do in hospital is Vran Dhupana we give. Vran Dhupana with neem chal, khadir, vidang and yasti madhu, and sometimes shiris also to remove the toxicity in the skin. So this also works very good, followed by Panchvalkal Kwatha wash.
But this is when you're treating the wounds, correct? It's not when the
Yes,
wound
yes,
is.
yes. But it will still have case is discharged, but still some effect is still there. Flexibility issue and all.
Yeah, and I've seen some references where Panchakalkala Kwata is used as a liquid for preparing Shatadauta Gruta. So, but Dhupana as such can be little pitta aggravating and would cause increase of burning sensation.
No, no, it won't. Actually, we thought like that, but while doing, we don't face such issue.
Okay, and for how many days would you recommend Ranadupana?
No, that depends on area and severity. Usually for 3 to 5 minutes, thrice a day we give.
Do you mean Vranadupana can be given if we can consider even the burns or the whatever has scars have been left over after the burns? If we can classify them as Sama and Nirama again.
Yes, sir.
Like
It will, because in Sushruta, Dagda Vrana is there. Vrana Utkrama, so many Vrana Utkrama, Sushruta had mentioned. In that, for Dagda Vrana also, he has mentioned Dhupana. Dagda Vrana is burns wound.
like Dhupana you would prefer when there is some oozing or secretions and discharges, and if it is totally dry you will go with Kshiradhara and also Sneha application as Gururaja sir has
No,
mentioned.
in dry also, Sirisha is told as Vishagna, Agre Dravya. So simple Sirish, the Sirish Pancha and Dhupana also we give to remove the septicemia, or it will prevent further septicemia if we give
Okay.
continuous Sirish Dhupana over the skin.
See, my understanding is that whenever there is an immediate burn, or a fresh wound is there, burn is there, then Panchavalkala Kwata, Prakshalana, and even such type of Dhupana, all those things, in order to overcome avoiding the infection and their complications. But here the case is already treated and it is discharged from the hospital and complaining of itching and flexibility issues. I think the wound might have been healed very well. Only thing is that is the complications of the burns. Now we are trying to do it here in order to avoid that flexibility issue and itching. Both are due to Vata. In order to nullify the effect of Vata, we need to go for the Taila Dhara, and it will be more prominently, it may be containing anything like Mahanarayana or Murivenna Taila Dhara. That will be beneficial. But whenever there is a fresh wound and there is a oozing and that type of thing, then Panchavalkala Kwata is used, as well as even Ranadupana can be done. That will be fantastic.
And there is further addition to this question that the child is still in bandages and something internal will be useful for the burns. Maybe something like Ushira Sava, Chandana Sava, etc. might be also useful.
In that case, if the child is could be able to drink the things, then better go for Mahamanjishtari Kashaya in small doses.
And somebody has asked if Jatyadi Taila is a good choice in this case. Maybe for in the burn stage may not be that much useful once the healing process is completed, sir?
You see, when there is an open wound still, then there is a role of Jatyadikrita Dhatvya Taila. Once the wound is healed, then the post complications of burns are there, like irritability or even burning sensation or stretchability or flexibility issues, then it is rated with Vata. So we need to handle the vata properly there.
Yes, after the recovery from the wound, we should use Sandhani Mahakashai because when Asthi Vidradi in Susruta has given reference that after Asthi Vidradi, when everything is destructed, I mean tissue is destructed. In the burn case, we take as a skin and skin tissue is destructed. We must make them align in normal anatomical posture. So to start that, we use I am using Sandhani Mahakashaya tablet. So I am finding very good results in such cases where tissue is destructed like that.
Which company manufactures that, if I may
No,
ask?
Sandhani Mahakashai, no company is preparing. We are, I think, 8 to 9 herbs is available from that 10 group, 10 herbs. So we are making a tablet and we are giving in post wound and burns also.
Okay.
Means wherever we require Sandhan Karma, where there we give, even in bone fracture and here in skin also.
Okay, quickly give the reference of Sandhaniya Mahakashaya. It contains Madhuka,
Yes,
Madhubani.
Charak, Sutrasthan, yes.
I think that completes this. Raghuram sir, any points on this, please?
Yeah, logically speaking, I would like to invite Dr. Rajnikant once again here, as he was mentioning Duma. So that has been mentioned in the Vaikrutapaha stage of Saptopakrama.
Yes.
In Shashti Upakrama, if you
Yes.
can classify into Saptopakrama.
Hmm.
So last, I think almost all the measures which have been mentioned in Vaikrutapa, those 26 measures, permutations and combinations, Dr. Rajnikant, we can include, I think so. When we go through that,
Sorry, sir?
all those 26 measures which have been mentioned in Vaikrutapaha stage,
Yes. Yes.
can be included in permutations and combinations, different combinations according to what type of wound, how it is remaining, what scars, and what we are intending to do there. Okay, so
Yes, sir,
depending
definitely.
almost your Duma also comes as one of the 22nd step in Vaikrutapaha. I think
Yes, sir.
almost all Utsadana, Avasadana, Mrudu Karma, Daruna Karma, Kshara Karma,
Brown
Agni.
Basti will be also there, I think. Direct injecting the medicine into the wound. Brown
Yes,
Basti.
Vasti, Uttaravasti, everything has been mentioned. Krimigna, Bandha, Brumhana also has been mentioned towards the end. And it ends with Raksha Vidana, that is sterilization method. So I think it is a comprehensive package we can use here.
Moving on, difference between sesame oil versus coconut oil on the skin, and how it is absorbed till what level. Gururaja sir had made a comment that whenever there is deeper tissues involved, and a typical vata roga wherein the joints, the deeper ligaments, etc. are involved, there sesame oil makes sense much because it is a hot, deep penetrating, lekhana, ushna, all those things. Whereas if it is locally involved with skin and superficial tissues involved in a skin pathology, as in case of a probably skin disorder, especially with the high pitta and vata dosha, there keram or coconut oil would be more useful. So the question had come in the last session, dear sir, about thailam and keram. Can you please talk more, as study it says not much difference in herbs are absorbed. You already explained keram are more for skin related problems, that is superficial, and thailam for non-skin related problems, meaning deeper tissues involved, the muscles, the ligaments, the bones, etc. Is there any other consideration? And I've just compiled a few sesame oil qualities versus the coconut oil qualities. Sesame oil is right away ushna, hot. VAY gets absorbed and enters deep into the body channels very quickly, and is strong and deep piercing. Tikshna brings about clarity, and it is sara, it spreads very fast and loosens the joints and has lekana property, so on and on and on. And whereas our coconut oil it's cold, slightly harder to digest, and it's nourishing, strength promoting, and vata pitta balancing.
See, first we need to understand that all the tailas are vatahara in nature. It may be coconut oil or keram, or it may be tilataila tailam, or even sarshapa tailam. But with that common factor, it also has a specificity. Like any dermal tissue involved to a certain level, along with any hair fragments or hair is involved. So where there is something which is related with the hairs as well as the skin upper layers, then keram is the best one. But if it is from the skin level still deeper to the ligaments, tissues, and even to the bones, then thailam is best one. But wherever there is Tivra Kapha involved in any skin condition, to overcome that, Ushna oil is required. Then better thing is Sarshapa Taila. So in this way, we need to differentiate which suits to our requirement. Otherwise, even Tilataila is also Ushna, Sarshapataila is also Ushna. But Sarshapataila is more Ushna than Tilataila. Whereas Acharyas have given full credit to Tilataila with respect to its function in based on its Ushna Guna, its Saraguna, its Vivai Vikasi Guna, and it is Twachya, Keshya. It also used in all sort of Bhagnas, Chiddavrana, Baddhavrana, all those things, even Dhara used made up of Taila. That is Tila Taila. So that differentiation we need to make it.
Even in the case of Taila Varga explained by Sushruta, he also clearly classifies a group of oils into Ushna and Shita, and he explains Ushna Varga first, and again Kapha and Vata Pitta as two categories, and he goes on to explain the use of these oils. And there is another unrelated question here that, dear doctors, I have a long-standing query. Is the culinary tradition of including a small quantity, just a teaspoon of urad dal called as masha or the black gram in daily cooking there in Ayurveda to provide us the benefit while avoiding unwholesome aspects like avoiding skin problems due to its rakta dushti property? In South, mustard dals like urad chana, etc., curry leaves are preferred to use in the seasoning, what we call as Vagarana in Kannada. While in North, mainly jeera, etc. are used. Such common ingredients, hing, haldi, etc. exist. Any Ayurveda basis for these differences? And there is also a reference that the masha, the black gram, is not advised to be used on a daily basis, though it is vrishya, brahmana, etc. But still, in the culinary uses, as in case of say seasoning, using it in a small quantity is valid. Gururaja sir, please.
First thing is that using that masha or even the chana or something like in a small quantities in seasoning any dishes or culinary preparations, it doesn't going to stimulate your doshas to such a level which can cause a disease. So it doesn't hold any untoward effect on you. Usually it is in a very small doses. What acharyas have explained about the untoward effects of these drugs like urad and it's causing kapha pitta related issues and all those things when it is consumed in a large quantities. Comparatively.
Yes, sir. And mainly when it is used as a staple one, meaning say taking urad dal vada on a daily basis for a long time. So that's where this comes. But still, using it in a small quantity would still infuse some amount of its health benefits, sir?
Definitely, when this is added in a small quantities, it is for the purpose of giving a typical flavoring and even to the impart the immediate requirement of dishes to be finished. Now, there is a basic difference between the north and south, the way of cooking. In the northern India, the way of cooking is mostly oil based or ghee based. When they cook the dishes, they will be going for oil based and ghee based. That's why their thadka or vagarne or what seasoning will be an entirely different form of hing, jeera, haldi and such things. But in southern India, the cooking media or cooking method is entirely different method where it is a water based cooking system. And here these jeera, haldi and all those things are already added to the sambar or something like that, what the preparation they make it. That's why by giving the seasoning, they go with the ghee or oil with some sort of mustard or even some jeera, something like that for the thadka or the purposes. So it may be just to stimulate the agni inside, or it even it is still to certain level or giving a finishing touch to the dish. It is not going to harm in any way.
Namaste, doctor. So you said like it's not harming in any way, but my query is more, is it benefiting? I mean, just like small doses will not harm, can we conclude that even such small doses will not even give the benefit like of Rishya, Balya, etc.?
See, we need to understand for what purpose we are putting those drugs there. It is for the taste to improve or enhance or to give the dish the finishing touch, or which should taste good for eating, and that purpose can be brought about by the rasas of these drugs. That's the reason we put those things there. But doesn't mean that we are expecting a brahmana karma by adding half a spoon of masha to a dish of half a liter or 1 liter prepared in the form of a curry, and that we expect that issue from using that we need to get the brahmana karma. No, that is not possible. There is a typically volume attached for every drug. Every drug has a certain potential. That potential needs to be taken in typical rashi. It is said are the quantum, then only we can have the typical effect of that. It may be untoward effect or the right kind of effect, or affect or effect. Both can be achieved in particular Rashi if it is taken. Quantum. The other reason for this, Udad dal and these things come under the category of Ahara Dhanya. They are Rasa Pradhana Dravyas. Whereas the other things which you are talking about, the herbs, basically they are all in the Aushadha Varga. When there is Aushadha Varga, they are Virya Pradhana. They are more potent and more stronger. We can't consume the Udad the way that we consume Udad. In the same way, we cannot consume Amalaki. We cannot consume even the Haritaki in that manner. So that is the reason.
Right.
Aushadha Dravyas have a stronger Virya, whereas Ahara Dravya has a much more stronger Rasa. So here Udad and all those things are working basically on that Rasa Pradhanata. That's why we use it in the form of making a culinary preparations, and we use it in the manufacturing of food and giving seasoning of the food and all those things.
See, in South, especially in South India, we take a lot of idli, dosa, and other things. Some states like Tamil Nadu, adequately, almost daily, they take idli, dosa, where udad dal or masha is used in abundance, and people are not finding any problem, or because it is a geographical food, it is a staple food for those people, and it has become satmaya. So like it has been accustomed for those people. If they don't take that, they might face a problem. So if they go to some other place north, they may search for a hotel where idli and dosa is available, because it is a mind food. So food is a concept which is related not only to the body but also to the mind and also to the emotions. So idli and vada and also dosa are emotional food for us, the South Indians. So even if we go to other country, we will search for a hotel where we can find idli vada and also dosa, so that doesn't harm. So that is number one. So because it has been accustomed to, we are using and many consider like there are countries which take non-vegetarian food on a daily basis. So here masha is considered to be mamsa samana. Masha, mamsa. Many people consider for vegetarians, because they are not taking mamsa, masha or black gram is a substitute, it will provide similar benefit. So again, mamsam mamsena vardhate. So we have the like enhancing the like properties. Like by taking mamsa, it increases mamsa. That is a concept given in Ayurveda. Raktam raktena vardhate. Take blood and it is a substitute for rakta. So going by the like properties, samanya siddhanta, going by this particular principle, Mamsa increases the muscle health in the body. We know that muscle health is very, very important for our daily activities. Where do the vegetarians get it from on a regular basis? So it is through the masha. So regular consumption and making a habit is also there. Apart from the thadka, so where we use in small quantities, Gururaja sir rightly pointed that it might not provide Brahmana, Vrishya properties if you take it in a small quantity. Okay, even this idli and dosa are the morphed things. So like we have changed its structure, we have combined them with so many things. We take vegetables along with that, curries along with that, chutney along with that. We are taking a combination. It's not like masha. And we also have masha taila. So like the oils which are prepared using masha, mahamasha taila and also masha taila, which is used as vatahara. So to support the muscle tissue, and also in some cases, I have also seen that masha and mahamasha taila abhyanga on a regular basis in conditions where the muscle tissue has been lost or is deteriorating. In such condition, it acts like a supportive medicine also to the muscles, and also it enriches muscular balance in the system. And very importantly, Gururaja sir made a point that should be underlined in block letters, that masha is included in ahara dravya. So I think that summarizes almost everything.
There are again a couple of questions on for cooking, which oil is better and which oil is better for deep frying foods, which it has been made very clear by Dr. Gururaja sir and everyone that it depends on the region, and it depends on what your grandma was using for cooking. In some areas sesame oil is used, some areas in Kerala coconut oil, and in some areas mustard oil, etc. are used. This has been already discussed. Please go through the YouTube channel of Easy Ayurveda.
Good evening, doctors. The question I have is, in our food, we use a lot of Asafoetida or hing. I always wondered how much is it a good idea that that we use it, or because I understand it has a medicinal value, are we reducing the benefit of it by using it on a daily basis?
Yeah, I mean, there are some ingredients which are used both for the culinary purpose and also for curing or treatment purpose. And Asafoetida is one such thing. And it is not, and there is primary difference between how a modern drug acts and Ayurvedic spices act. If we are taking, for example, antibiotic on a daily basis, we would develop resistance. The bacteria and the viruses would get accustomed to it, and it becomes invalid, or it becomes inefficient in treating. But such a thing does not exist in Ayurveda, and it's not. Asafoetida is not just one chemical that we are using. It's a wholesome herb as such. Thus, there is no effect of per se being used daily would decrease its medicinal value when we are using, say, Hingua, Sakachurna, etc.
See, first of all, we need to understand Hingu comes under the category of Ahara Upayogi Dravya, the one which is prepared or used for the preparation of Ahara. Second thing, on a daily basis, using Asafoetida, there is no wrong, you can use it. Thing is, the quantum of Asafoetida, what we use in the preparation of a food, it may be at least 4 members in a home, and for maybe for 1 or 2 food purposes we use it. But doesn't mean that when we give it for a purpose of a treatment, the entire dose what you are putting for a vessel of your sambar or your curry, the same thing goes in a one dose in that fashion. So that is the reason Rashi or the quantum of the material is very, very important. So these categories, particularly Asafoetida and these things, they fall under the category of Ahara Dravya as well as Aushadha Dravya, or somewhere between that. So because of that reason, it is Asafoetida or Hingu works wonders even as a medicine as well as on a regular daily basis. It is helpful in removing the vata, avoid formation of gas inside the abdomen, and it helps in digestion, and it is very good vatahara also, and also Agni-Vardhaka. So these are all the things. Benefits will be there. Of course, when we are visiting in the form of a food, the same thing when we want to have as a medicine, then the whole dose what we use it for the entire vessel, the same thing will directly go with the one dose of a medicine. That's the difference.
Yeah, I think Gururaja sir has comprehensively touched upon this point of Hingu, Asafoetida. Again, coming to the thadka, so we in South India, so many families we use Hingu for thadka, for Garne. So that has been used. We are not using Hingu as such, but we are using it for thadka for 2 purposes mainly. One purpose has clearly been explained by Gururaja sir, like Vatanulomana and many other medicinal properties. Apart from being a food substitute, it has another thing is a fragrance. Many people may not tolerate the fragrance of Hingu, but those who are used to. I personally cannot say I can't digest that some food in my home is prepared without seasoning with Hingu. So we almost use it regularly, and we have found no problem. And again, the matra, again we are using for seasoning only a small quantity, small pinch quantity, almost every day. And when it comes to the medication, already Gururaja sir said the quantity and the Rashi will increase. So there it will be for a stipulated time period that we are giving, maybe in the Hingvastaka Churna form or Hingu, Barjita Hingu, whatever we are giving. Again, in South India, there is a saying in Kannada like Hingu Tengu idre manganu adge madatte. So like 2 things, even a monkey can prepare a delicious food if you have Hingu and Tengu, that is Asafoetida and coconut. So that itself, this is a proverb which has come through ages. That clearly means it has been used through ages. And these are the ingredients of the food which not only increases the delicacy of the food and also, so they're used for seasoning and also topping so many food ingredients. Hingu and Tengu, as somebody rightly commented, a lot of coconut and coconut oil is being used in Kerala. We think why? Because they're growing it in bulk and they've been habituated from, and the Tengu or the coconut has been carried through genes. We may not tolerate that much coconut as Keralians tolerate. So because they have been used to that, so probably it has been carried through the genes. We have spoken about similar such topics like chili and other things in the past. So there's no problem in using a Hingu in small quantities daily. Again, we need to have a line of differentiation between Hingu as a food substitute and the Hingu as a medicine. Thank you.
Gururaja sir, please.
On the similar grounds of Dr. What Raghuram sir has said, locally at certain areas, there are certain satmyas are there, or you can call it as a voka satmya or some satmya are there. For example, even we find such references even in Charaka. Very clearly, Acharya says, Vanga Deshe Matsya Satmyam. Fish is very much compatible to the everybody in Vanga Pradesha. Sindhu Deshe Saindava Satmyam. So in Sindhu Desha, there is a totally every food will be having a more dominancy or presence of Saindava Lavana in it. So Lavana Satmya will be there in Sindhu Desha. Whereas in case of Vanga Desha, Matsya Satmya. Similarly, different part of the localities based on the geological conditions are there Satmyata. That area will have a typical predominancy towards one or the other things. So that's why in Kerala and these coastal Karnataka region, Tengu or coconut is more prominent. They use it coconut in many conditions. Even coconut oil is the cooking media.
So a lot of us these days move from one place to another, and we adopt the local cuisine. Is there a harm in doing that?
Definitely, to some extent, there is no harm. But if you want to just totally convert yourself into that, then it requires a certain time. Slowly, we need to adopt only when you are there. For example, if you are in a North Indian, you are taking a North Indian food in Southern India, maybe over a period of time, okay, then slowly adopt to the South Indian food to some extent. But still, your body and your genetic mapping is in such a way that it won't support you in the long run. So that needs to be very carefully handled. That's the reason many a time the pizza burgers may be very good to the Europeans and Americans, but may not be good to us in India. That's the reason we need to understand.
Yeah, so about this particular question, it's an interesting question as well. It depends on why you have gone to a different place as a visitor or to stay there. So if you have gone as a visitor, enjoy your food, come back. If there are some imbalances, we are there, we can prescribe some medicines, take that and it will balance. But if you have gone to stay in that particular place, like the example, South India to North India, North India, maybe from India to some other country, or switching between countries, and your plan is to stay there for more number of years. Obviously, as per the saying goes, be a Roman when in Rome. So you have to adapt to certain food, certain regional foods, because your likable foods may not be available very regularly there. You need to adapt to certain foods which are almost similar to the foods which you have been taking according to your comfort zone. By doing so, even Ayurveda tells that there should be krama abhyasa. That particular word Gururaja sir also mentioned. So there should be a gradual increase. Like for example, smoking. If the person is smoking from 20 years, if you ask him to give away the smoking, if he pledges by today evening I'll stop smoking, then his health will be disrupted in a different way. So sudden attachment and sudden detachment is very dangerous for the body and mind. We need to replace in portions, small portions, like take one portion of the new country and the 9 portions of what you have been used to initially, or a week or 15 days. Gradually increase 2 portions of that country and 8 portions of the other country in which you have gone. So gradually increase and gradually. So this is also a rule in Rutucharya, like when we are shifting from one season to another season. That is why there is a concept of Rutusandhi, the junction between 2 seasons. Gradually, slowly, we need to detach certain things of the previous season and make the habit of the next season very gradually. So this krama abhyasa and krama vetireka, so gradual adaptation and gradually giving up certain things and adapting certain things should be done by focusing on what balances and imbalances and how our body is reacting towards those new inclusions and exclusions that needs to be seen. So focus on your health, body health, mind health. And very importantly, as we said, the bottom line, again, block letters underline is any food you take with love. So body will try to digest and assimilate that.
Can castor oil be used externally for nerve pain, or sesame oil is more preferred? And I heard some say that castor oil can relieve pain quicker. When we come to many of the herbal oils used externally, this is specifically for external application. We do not see much of the castor oil used for external application. Although castor oil, abhyanga and massage, abhyanga is part of many people's routine. Coming to the shloka, this from Yoga Ratnakara, it says Balya Guru Ushna Madhura Sara Pitta Ushna Pittala and Kriminashana Shulagna Marudh Pranasham Kustapaham Chapi Rasayanam Pitta Prakopa Nida Shodhanam. It's explained. Why there are not much oils for vata balance for external application with castor oil, and castor oil alone massage, and compared to that with sesame oil, how good or bad is it for nerve pain?
See, we need to understand when we have two or three best things are there with our disposal, why we will go for the other one. We have a oil which is most suited for us, and that is in the form of typically what do you call again typically this tilathaila yukta oil based material is a very good one, and definitely that will when in front of us which has such a wonderful oil, why we want to go for the other one. Second thing is Eranda Taila will be more stickier and more somewhat having a pungency when compared to Tila Taila. So maybe because of that reason.
So here, importantly, we can see Pitta Prakopa Anila Shodhanam Cha. So when we speak about Shodhana, so it is like we are giving internally. So castor oil based medications are mainly, see what Taila is said to be the best for Vata, Gruta for Pitta, Madhu for Kapha. So like Sapana or Anupana or in the form of the main medication. So internally or externally, here the question comes. Gururaja sir pointed out the right thing. Tilathaila based medication oils, whatever is there, can be used in the external therapies, and also tilathaila can also be considered for internal consumption in the form of taila or yamaka or trivrata by combining it with the other medications. So coming to the internal consumption, I think Eranda Taila has an upper hand over Tilathaila here, because Tilathaila cannot do the Maruta Shodhana as effectively as the castor oil or Eranda Taila does. I feel here difference lays. So whenever you are thinking about the internal healing, like there is a sprain, there is a pain, slight pain, and you want to give a massage. So there you can go with some oil which has been prepared with the medicated oil prepared with the sesame oil or tilathaila, and give a abhyanga for certain days and swedana and take care of locally disturbed vata. Now we have diseases which in which vata is severely aggravated and the sthana samshaya is there. It has affected many tissues and organ systems and has caused many diseases. Like we have a big set of vata vyadis or vata disorders. In such conditions, just giving a massage with tilathaila will not be helpful. What to do? We will go for the internal consumption of oil, because oil is the best for vata. In which form? Castor oil. Again, in Amavata also it has been mentioned that Eranda Taila is the best for vata. So like Eranda is considered to be like a simha, so like a lion. For a vata, which is this is an analogy which has been given here, the simile. So what if we consider vata as an elephant, a mad elephant running in and around? Only one thing can control that elephant, that is the castor, that is the Eranda, which is in the form of a lion. Only a ferocious lion can control the elephant, so a mad, intoxicated elephant. Similarly, for vata shodhana, if the stubborn vata, we call it as stubborn vata, which is there inside, which we need to evacuate it and not just apply. So in such conditions, I think Eranda Taila or castor oil preparations will be the best ones.
This is from Charak Samhita Shloka. Shrota Vishodhana cleanses body channels, Twacha improves skin qualities, Vrishya aphrodisiac, anti-aging and rejuvenating, cleanses, uterus, useful in cleansing. Shukra Shodhana using, cleansing semen and reproductive tissues in men as well, improves oral health. Medakara improves intelligence. Smritikara, memory. All these things are more related to its internal use more compared to the external use, probably hinting there that quite commonly used for internal use than external one.
I just want to go back to that this one, uses of castor oil. Here also Prushtashula, Guhyashula is there, useful in low backache and also in the pain of the groins and other regions. So here also it is due to the internal consumption only. It is not that Eranda Taila should be applied on the back. Here also it is mainly targeting towards the internal consumption only. And Adobhaga Doshahara, expels vitiated doshas from lower part of the body in the form of virechana. So that can be used. Shukra Vishodhana, here is the point I wanted to stress upon. See, Eranda Taila is having such a cleansing effect that it is even, it goes to the deepest tissue. So when we consider the chronology of tissue formation in Ayurveda, Shukra comes at last. And Shukra is also considered as Marma at some in some instances, and also we have seen Prishtashula and other things. So Marmasthi Sandhigata Rogas also this Eranda Taila can be used, especially when given for internal consumption to improve motility and to treat sperm defects. I don't think this property is applicable to Tilataila. So here, when it comes Shodhana, it is internal consumption and it should be the Eranda Taila itself. It can go to the deepest tissue and has its cleansing effect.
And you were saying that, when we have a best oil for external application in the form of sesame oil, castor oil can be a secondary option, right, sir?
Yes, the castor oil be secondary option. The reason is when compared to the Vyavahi, Vikasi, Guna and Sukshmata, Tilataila is much more penetrative in nature. That's the reason it is being told everywhere. And probably when they prepare oil, I think the combining effect or the ability to imbibe the material or the herbs is more better in case of Tilataila when compared to Eranda Taila. That's the reason many a times we find more of Tilataila Yukta oils in our market.
Yeah, that's also another very good biophysical. It's less viscous. Sesame oil is less viscous than castor oil, and probably its absorbability is good. And it's already told, I think, in one of the previous slides, that Tailam Anukte Tilod Bhavam Sol and Nasti Tailat Param Kinchit Aushadam Marutapaham. So there is no better thing to think about in when it comes to vata balancing than the sesame oil itself. And Kshipratara and Hanti Sukshma Margasthitan Gadam. So it goes deep. Again, the Vyavahi Vikashi Guna that Sir is explaining is also very well explained here. Therefore, our oil is cooked for 100 times and 1,000 times with a group of herbs, which will alleviate vata dosha. It gets served very well to all parts of the body, well with sesame oil, is the explanation here.
I want to give examples of two tailas. One is Nimbamrutadi Tailam and Nimbamrutadi Eranda Tailam. We have two medicines here, two oils. Nimbamrutadi Taila is prepared on Tilataila basis only and it is used for external application only. It should not be given for Shodhana purpose. When the Eranda is applicable, Nimbamrutadi Eranda Tailam, when Eranda is applicable, only it is used for the internal consumption. So it is very much specified. One of the patients had accidentally purchased an Nimbamrutadi Taila instead of Eranda Tailam long back and had consumed it and had some gut related issues like loose motions, vomiting and all those things. He said it was not tolerable and he sent a photograph of that. And I said, you purchased the wrong medicine, you could have asked me. I clearly mentioned Nimbamrutadi Eranda Tailam. So this happens when the pharmacist in a hurry gives Nimbamrutadi Taila instead of Nimbamrutadi Eranda Tailam. So here the ingredients are the same, but the Taila and Eranda Taila, that makes a difference.
Thank you all. See you in the next session. Namaste.